The 7 most dangerous signs of diabetes. The warning signs. Do you know what are the symptoms? That sugar in the blood is too high, that glucose and glycemia is high. So pay attention to this video. What are the 7? Number 1, called polyuria. What is this? A lot of urine. You're going to the bathroom a lot. You are waking up to urinate. You are not like that. Now you are noticing. You have to urinate several times a day. Why does this happen? To try to compensate. The kidneys can eliminate glucose. They can eliminate sugar. When your blood sugar increases, in a compensatory way, to try to regulate this, as the body thinks it can, the kidneys end up eliminating sugar. So a lot of urine. This symptom of eliminating sugar usually happens when the kidneys, they are not working. The increase in sugar usually happens when the levels of sugar in the blood are higher than 180. So that slight increase, for example, in levels of pre-diabetes. For example, 105, 106. This will not happen. Often diabetes can be asymptomatic. There is no symptom. These are the dangerous symptoms. So mark this, a lot of urine ants in the bathroom. Why? Because as the urine is sweet, this is not a myth, it can attract ants. So ants in the bathroom. I will put here our first sign. Number 2, as you are urinating a lot, you can be dehydrated. And another body response is very thirsty. You will drink a lot of water, even very high values, 4 or 5 liters per day, as the kidneys will eliminate water with sugar, water with glucose. In response, you can be very thirsty. And also, if you have a stimulus to drink more liquids, this is also a way to compensate. So 2 signs that we already talked about, a lot of urine, a lot of thirst, and the 3rd most dangerous sign of diabetes, losing weight. But they said diabetes makes you fat, but if you are losing weight, this means that the blood sugar levels can be very high. The insulin hormone is not able to act, or your body is not producing insulin. What does insulin do? It takes the blood sugar and transports and puts it in the cells, in the tissues, in the muscles, for you to get energy. If this hormone cannot act, you will lose weight. Who does not know a person who lost weight? A person who lost weight without doing anything, without dieting, without exercising. So you have to warn her to do the blood sugar test, to look for a doctor, to see if it is not diabetes, because weight loss is one of the symptoms of alertness, symptoms of danger, of diabetes. 4, tiredness. If you are very tired, that fatigue, you wake up tired. One of the most frequent symptoms of diabetes, it is tiredness, because your body is without energy. The blood sugar, it had to be serving as food for our cells to be able to produce, but it is in the blood. It is high in the blood. So this will generate a symptom that is a symptom of tiredness, lack of energy, lack of disposition. So this is our number 4. Number 5, frequent infections. And here I will put skin infections, urinary infections, for example, even respiratory infections. Because when the sugar is high in the blood, our defense cells are compromised. They cannot act in the same way. So pay attention. Many times I end up doing diabetes diagnosis for a urinary infection of repetition. Let's evaluate the part of the sugar in the blood. It is there. It is well increased. Why? Because the defense cells, they cannot act. So if you are having infections, even in the skin, fungal infections, so you have to do an exam to see how it is. The part of the glycemia. Number 6, a lot of hunger. The so-called polyphagy. You feel very hungry. You are eating a lot. Not being able to be satisfied. Not being satisfied. So if you are very hungry, it is mandatory to think about diabetes. And diabetes at a very high level, because it will be difficult to have insulin, as I explained in the weight loss symptoms. So a lot of hunger, even eating a lot, you will lose weight. It seems very strange, but it happens. Number 7, difficulty healing wounds. Because vascularization, the blood vessels, the nutrition of that wound, and also the cells that make the healing can be compromised. So pay attention, right? Mark your own pattern. If you are noticing that the wounds are taking longer to close, this is a risk factor and can even lead to other complications. Now that you know the most dangerous signs of diabetes, I will answer a very frequent question you ask in all the videos, which is about the values in diabetes tests. There are 3 tests that I want you to know, okay? The first and most frequent is the fasting glycemic test. This fasting glycemic test is normal until 99. From 100 to 125 is considered pre-diabetes. From 126 up is considered diabetes. Remembering that these tests must be repeated at least twice. In this fasting glycemic test, I will put an asterisk here for the Portuguese friends who follow the channel. For Portugal, the European Society of Diabetes considers normal until 109. From 110 up then, it would be prediabetes. Prediabetes would be in the range from 110 to 125. This note is the only difference between the American society we follow and the European society. Okay? But it is important that everyone knows. Many times you will consult in Portugal, the doctor will say something, so that's why. Another test also used for diagnostic diabetes and monitoring is the glycated hemoglobin test. This glycated hemoglobin test is normal until 5.6. From 5.7 to 6.4 is the level of prediabetes. 6.5 up diabetes. The last pre-diagnostic test for diabetes is the oral test of glucose tolerance or TOTG. It is that test that you go to the lab and take 75 grams of glucose. How does it work? You do the test, take the glucose, and after 2 hours you do a new test. Just to see how your body behaves, how the sugar in the blood is, how your metabolism is. This test in 2 hours is normal until 140. From 140 to 199 is the level of prediabetes. 200 up diabetes. It is worth remembering that in gestation the values are different. The diagnosis is made differently, with other values. If you want a video just about that, write in the comments here. From 0 to 10, what grade do you give for this video? Did you like it? Did you not like it? Put it here for me. Also talk about the city. Which part of the world are you watching this video? The bridge back here is the 25th bridge of April, in Lisbon. You always ask. I forgot to tell you at the beginning of the video, but who was in doubt, this is the place. Now I'm going to leave a suggestion for you. It's a video where I gave 12 tips to lower glycated hemoglobin, so you can improve the blood sugar levels. If you are diabetic, you should watch this video, which I'm sure will help you. A hug.